Why those statistics I read are those that women are not being referred as often for imaging, and that women are not getting balloon angioplasties and stents as frequently. What's going on?
Well, I listened very carefully to the previous speakers, and I'm an obstetrician gynecologist, and the perspective I'd like to bring to the table is that women are referred later because I think sometimes they just appear later with their symptoms, and
well, part of that, right, is estrogen has a protective effect.
Exactly.
So if you're not menopausal,
right, premenopausal women, it's a lot more difficult to diagnose cardiovascular disease. Postmenopausal women, it's more evident and more prevalent. But again, most women go to their OBGYNs for their care, and they don't always have a primary care physician. Right. So there may be a delay in actually a lot of the preventive tests the screening tests that should be sent out, and that causes a delay in picking up a diagnosis.
Right. Well, I have read statistics that indicate women do tend to be diagnosed at a more advanced stage.
Absolutely.
Of coronary disease. Okay, so one of the first messages we want to get out is, if your primary care physician as a woman is an OBGYN,
right,
you have to tell the OBGYN that he or she is the primary care physician, right?
You have to advocate for yourself. You have to let your OBGYN know that they are the only one who's caring for them, and the patient, the woman herself, should make sure that she's getting her blood pressures checked, that they're sending out a screening cholesterol, they're listening to their heart, getting a full physical exam, because the OBGYN may assume that you have a primary care physician and not do a lot of the screening tests that are important for the woman.
She didn't want to go to the hospital. I mean, is one of the problems that women tend not to seek treatment because they're caring for others?
Absolutely. As a matter of fact, I just read an article about caretakers and the higher incidence of heart disease in that population. And we're talking about not the usual caretakers, women with young children. We're talking about grandmothers raising grandchildren, and other women taking care of other adults in their home. So yes, women tend to take care of everyone else except themselves. They are the last to go to the doctor to seek care. They're the last to go to the emergency room when they need care. So yes, it's a classic sign that we see all of the time, that women do not take care of themselves first. They take care of everyone else, and that has got to stop if we want to do something about heart disease.